Hello, welcome to the online lecture on breastfeeding recommendations, epidemiological trends, and the medical advantages of breastfeeding. By the end of this online session, you should be able to describe current breastfeeding recommendations and epidemiological trends, describe at least 4 factors that increase the strength of a research study's findings, and at least 5 medical advantages for the breastfed infant and the breastfeeding mother. So let's start off by discussing what are current breastfeeding recommendations. So what I'd like you to do is I'd like you to pause the video, get a piece of paper, and write down what you think or know are the current breastfeeding recommendations. How much breast milk should an infant get and for how long? Once you're done writing it down, please turn the video back on and let's look at what current breastfeeding recommendations are. So did you say exclusively breastfeeding for 6 months, adding complementary foods, and then continuing to breastfeed for at least 12 months? Those are the current breastfeeding recommendations. So let's talk a little bit about those recommendations. So first of all, what do we mean by exclusive breastfeeding, or exclusively breastfeeding for 6 months of life? So again, pause the video and jot down what you think exclusive breastfeeding means. What's the definition? So hopefully you said something along the lines of feeding the baby nothing but breast milk for the first 6 months of life. Now let me ask you a question. So if I am exclusively breastfeeding, only giving my baby breast milk, but I give them some water on the days that it's hot, is that still considered exclusively breastfeeding? That's correct. No, it's not. So any fluid other than breast milk would be considered no longer exclusively breastfeeding. What about medicine? What if my baby's sick and requires some antibiotics? Exclusively breastfeeding my baby, I'm not feeding my baby any food other than breast milk, no formula, no teas, nothing, no water, but they're sick and I give them antibiotics. That's correct. So if you give medicine to your baby, it's still considered exclusively breastfeeding. So for the definition of exclusively breastfeeding, what is used out there in the field is feeding your child nothing but breast milk, no fluids, no foods. However, medication is fine. Now, in terms of our breastfeeding recommendations, the recommendations are that babies breastfeed exclusively for the first 6 months of life, but then at 6 months we start to add some other foods. We call that complementary foods. We start adding vegetables and fruits and other foods. So by the time the baby is a year old, they're pretty much eating the diet that their family's eating. So here we have a list of a variety of health professional associations that all have statements that recommend that infants be exclusively breastfed for the first 6 months of life, add complementary foods at 6 months, and continue to breastfeed for at least 12 months. What I'd like you to do is read the current breastfeeding recommendations that the American Academy of Pediatrics has, the American Dietetic Association, and then also the American Public Health Association. So go ahead, pause the video, and read through each of those breastfeeding recommendations. You can take a look either on the video or on your PowerPoint slides that accompany this online lecture. And what I'd like you to pay attention to is the similarities and the differences between these breastfeeding recommendations. Jot down the similarities, jot down the differences, and then turn the video back on. What did you notice? A couple things I'm hoping you took note of is one, that all 3 of these professional health associations all recommend that mothers exclusively breastfeed for the first 6 months of life, their baby. Add complementary foods at 6 months and continue to breastfeed for at least 1 year. You might have noticed that the American Public Health Association recommends at least 1 to 2 years of life. You may have also noticed that the American Public Health Association recommendations are much stronger in terms of their advocating for mothers to breastfeed their babies, or that babies receive breast milk. In the American Public Health Association recommendations, they're not simply stating that it's optimal nutrition, they're taking it a step further and saying that if you're not breastfeeding your child exclusively for 6 months and at least a year or 2 with complementary foods, there are actually health risks that you're exposing your baby to. So they've got a much stronger statement. So bringing us back to our learner objectives for this session, the current breastfeeding recommendations are that mothers exclusively breastfeed their infant for the first 6 months of life and add complementary foods at 6 months and continue to breastfeed for at least 1 year. Some professional associations have stronger statements and others less strong, but in any event, this is optimal nutrition. Now, why do you think that professional organizations are advocating for mothers to breastfeed, period, but also exclusively for 6 months and to continue to do so for 1 year? That's right. There are a number of benefits for babies who are breastfed as well as for mothers who breastfeed their babies. For example, one benefit for the breastfeeding mother is that she will lose her pregnancy weight much quicker. Let's take a look at this short video clip.
I'm 40 pounds thinner. Yep, these were my pants, and now I'm down to a size 8 again. I didn't starve myself, and I didn't go on a fad diet. So what helped me get back to my target weight? I breastfed my baby.
Breastfeeding burns up to 500 calories a day. That's like 2 hours of aerobic exercise. So while it's good for your baby, breastfeeding is also great for your body. Breastfeeding. For my baby. For me. Call the New York State Department of Health WIC program at 1-800-522-5006 for information and support.
So that's one of the benefits of breastfeeding. What are some of the health benefits associated with breastfeeding for infants and also for the breastfeeding mother? I'd like you to pause the video and jot down what you've heard are some of the health benefits to infants and mothers that result from breastfeeding. And turn the video back on once you're done. Shortly, we'll discuss some of the benefits that are associated with breastfeeding for infants and the breastfeeding mother. But before that, I'd like to talk a little bit about how do you know the link between breastfeeding and health outcomes is strong. You might have heard that breastfeeding makes babies smarter or that it helps prevent obesity, but how do you know that what you heard is actually solid evidence and strong evidence? If you've taken a research method class before, or you're taking one right now, I'd like you to think about what are those factors that makes a research study findings strong. Again, pause the video, jot down any of those factors, and then turn the video back on. One of those factors is sample size. We have a research study that has a very small sample size, for example, 10. That study is not going to be as strong as a study with a sample size of, let's say, 1,000. Throughout this discussion of factors that increase the strength of a research study's findings, I'm going to use the example of research that has linked breastfeeding with a reduction in risk of being overweight and obese. So let's talk about the first factor, sample size. So if I have a very small sample size, let's say of 10 women versus a large sample size in my study of 3,000 women or mother, baby, infant dyads, the study with the 3,000 participants is going to be much stronger than that of 10. So let's say for this example, I have 5 women who have exclusively breastfed for 6 months, their infants, and then I have another 5 who exclusively formula fed their infant for the first 6 months of life. I take a look at these children when they're 5 and I look at the difference in their BMI rates, and I noticed that the sample that was exclusively breastfed has much lower rates of obesity than that of the formula-fed infants. So I may conclude that obesity can be reduced by breastfeeding, but again, the sample size is very, very small, so it's not too strong. But if I had the same type of research study with 1,000 participants, 500 who were exclusively breastfeeding versus 500 who were exclusively formula feeding, I would have stronger evidence. Another factor that increases the strength of a research study's finding is if we have meta-analysis. And for those of you who don't know, a meta-analysis is when we have several studies that are examining a relationship between, in this context, breastfeeding and a reduction in risk in obesity, and we pull them together. So if I have one study, for example, the study we just spoke about with 1,000 participants, if I had 500 who were exclusively breastfeeding and 500 who were just formula feeding only, that's a strong study with good evidence. But I have 8 studies that have examined the relationship between breastfeeding and obesity, and all of those studies found that there was a significant reduction in risk of being overweight when the mother exclusively breastfed that child. That's going to be stronger evidence than the one study. If a study is published in a peer-reviewed journal article, that too is going to provide us with stronger evidence than if it's published in a journal that has no peer review. For those of you who don't know, peer review essentially means that peers, individuals who are expert in that same field, are reviewing the article or manuscript. So in our example of the relationship between breastfeeding and obesity, if I have other researchers who are studying health outcomes of breastfeeding examine my research study, and they're looking for whether the study design is strong, whether my writing is flawed, whether the data analysis is solid, and it passes their review, it's going to be an indicator that that study is stronger evidence than if it wasn't reviewed by peers in that area. Another factor that impacts the strength of a research study is the type of design used. The strongest type of research design is the randomized control study. And for those of you who don't know, a randomized control study is essentially when we take a group of participants that we recruit into a study and we randomly assign them to receive the intervention and those to receive nothing, or what we call the control. So in the context of breastfeeding, this could mean us examining the impact of, let's say, a prenatal breastfeeding education class. We have some advertising where we say we're conducting a research study, and participants would be able to receive free education in breastfeeding when they're pregnant. We recruit participants, and then we randomly assign those participants to intervention group, which would receive that free prenatal breastfeeding class, and the group that doesn't receive the intervention or the education. This is called intent to treat. In this particular example, everyone, those who receive the education and those who are in the control group, expressed an interest in receiving breastfeeding education. So they all were motivated to receive the education, and then we follow them and see the impact of the education. It wouldn't really be a good study if we selected people who wanted prenatal breastfeeding education and compared them to people who had no interest in prenatal breastfeeding education, because there's a little bit of a bias there. Those who aren't interested in breastfeeding education are already predisposed to not wanting to breastfeed, perhaps. Another factor that makes a research study finding strong, especially in the context of breastfeeding, is how breastfeeding is measured. The research in the area of breastfeeding is growing exponentially. There's a lot more interest in breastfeeding research now than there was, let's say, 30 years ago. And along the same lines, the research has become much more sophisticated in the way that we measure breastfeeding. Older studies initially would ask women, did you breastfeed? And they would say yes, and then they would look at some of the health outcomes, but they didn't quantify the amount of breast milk or the dose of breast milk that those infants were receiving. And the study is going to be much stronger if the researchers actually quantify the dose. And what I mean by that is, how much breast milk did the infant get? Were they exclusively breastfed? If they weren't exclusively breastfed and they received some formula, how much? Because there's very big difference between a mom who is feeding once a day formula to their child and everything else is breast milk versus someone who is only breastfeeding once a day. And so quantifying the dose in terms of how much of the food the infant is getting that is breast milk versus formula, and then also how long did they receive breast milk, is really important to the strength of the study. Also, another factor is how far back are the participants asked to recall breastfeeding dosage. There is what we call recall bias. If you ask me to recall something that happened 50 years ago, I'm not going to be as likely to have an accurate recollection as if you ask me 3 months ago or 2 years ago. And some of the research initially in breastfeeding would ask participants who were in their 60s, did you breastfeed your child when they were an infant? And they would say yes or no. And then they would look at that adult child and look at their health status. Now, a 60-year-old woman is going to have a quite difficult time in recalling specifically how much breast milk she gave that baby and how long she breastfed, unless she kept a diary. More accurate, or the most accurate way to ask women about recall, which I have seen a few studies that do this. It's quite costly, but they actually, what they do is from the time the baby's born, they have a research assistant call and check in every few days and ask, are you breastfeeding? Have you given anything other than breast milk? If so, how much? And they document that, so they really have a good, solid sense of how much breast milk that infant is getting. Now, along the same lines of talking about factors that increase the strength of a research study's finding, I want to talk about the largest randomized breastfeeding study we have to date, because I want to show you what a really solid, strong study looks like in breastfeeding. Now, the challenge with breastfeeding research is we can't make someone breastfeed. We can't say, okay, I'm going to randomly assign these 100 women to breastfeed. Ladies, you must exclusively breastfeed your babies until they're 6 months. We can't do that. So the research needs to be set up a little differently. And here is an example of a really impressive study that was done in the late 90s to examine the impact of the 10 steps to successful breastfeeding on breastfeeding rates. And so before I go and talk about the specifics of the study, I want to make sure that all of you know what the Baby Friendly Hospital Initiative is, and then also what the 10 steps to successful breastfeeding are. We're going to go into much more depth about the 10 steps to successful breastfeeding and the Baby Friendly Hospital Initiative in a later session. But for now, what I want you to know is that there is an international breastfeeding promotion initiative that focuses on getting hospitals to implement specific practices that are linked with a higher likelihood of women breastfeeding exclusively and for longer durations. And so those specific practices are called the 10 steps to successful breastfeeding. I'm not going to go into all of those steps, but for example, one step is that there is what we call uninterrupted immediate skin-to-skin care, meaning that when the baby is born, immediately the baby is placed on the mom's chest and the mom has the opportunity to attempt breastfeeding. In a hospital that doesn't have that practice in place, what it would look like is the baby is born and they're taken to be bathed, to be weighed, to be given a vitamin K shot, and a whole bunch of other procedures that are required before the mom actually gets the baby. So in any event, in this study called the Probit study, what the researchers wanted to do was to gather some evidence to see whether or not these 10 steps that are associated with better breastfeeding rates actually, they do have an impact on women being more likely to exclusively breastfeed and for longer durations. And so what they did was they wanted to recruit a very large sample size of mothers and babies, and the recruitment took place for actually a year and a half, and over that period they were able to recruit more than 16,000 women and their babies. And what they did was they followed them. There were actually 3 phases to this study, one at 12 months, one at 6.5 years, and one at 11.5. I'm not going to go into all the details. What I want to focus on right now is just an example of a large randomized control study in the area of breastfeeding that was able to demonstrate and provide us with strong evidence that having the 10 steps to breastfeeding in place actually does help women be more likely to exclusively breastfeed. So the way that the researchers set up this study was they looked for a country that was similar to other developed countries in terms of breastfeeding practices, breastfeeding rates, and other conditions. And what they did was they selected Belarus, which is located to the Ukraine, because of the similarities to other developed countries. And those similarities include a variety of practices which at that time were practiced in the US and the UK, such as delayed onset of breastfeeding, as I described earlier, where baby's born, they're taken to the nursery, they're weighed, they're measured, and the mom only gets the baby an hour or 2 later, and the first breastfeeding is delayed. They also had things in place, practices such as scheduled feedings, where instead of the mother feeding the baby when she sees that the baby is demonstrating hunger cues, the mom would get the baby every 3 hours and be told, okay, it's time to feed the baby. I'm not going to go into all the factors on this slide. My point is that the hospital practices in hospitals in Belarus were very similar to those in other developed countries, and so too were the conditions that made, in some conditions that could lead to unsafe formula feeding practices in third world countries, such as having contaminated water, where if the mother chose to formula feed, she didn't necessarily have access to clean water, so therefore mixing the formula with that contaminated water put that baby at risk in a variety of other health problems. Also, things like adult literacy. If you have a country such as a third world country where there is a challenge with reading, those moms cannot read the label on the formula and they're not able to properly prepare the formula, which can lead to dilution, not using clean water, etc. So back to this study. The Probit study attempted to find a country that had similar health practices as other developed countries and recruited hospitals to participate, and then they randomly assigned them to either a control or intervention group. All the hospitals in Belarus at that time were not implementing what we call the 10 steps to successful breastfeeding. And so those that were randomized into the intervention group were asked to implement the 10 steps to successful breastfeeding, and they were asked to implement those 10 steps to successful breastfeeding. And the researchers followed those mother-infant pairs who delivered either in the hospitals that were in the intervention group that were implementing these 10 steps to successful breastfeeding, or at the control hospitals that were implementing what was standard hospital practices in Belarus at the time. And what they found was pretty significant evidence that implementation of the 10 steps to successful breastfeeding has a huge and significant impact on exclusive breastfeeding rates. They found that at 3 months, those infants who had delivered in the hospitals that were implementing the 10 steps to successful breastfeeding were significantly more likely to still be exclusively breastfeeding. So you see on this slide, 40% of the intervention groups were exclusively breastfeeding at 3 months compared to only 6% in the control group. So that shows you that delivering in a baby-friendly hospital has a significant impact on exclusive breastfeeding rates. So that's really strong evidence. Again, the study design was a randomized controlled study, and the data demonstrated profound impact of the 10 steps to successful breastfeeding. What they also found that was by 6 months, there was a difference between the intervention group and the control group. 7.9% of the intervention group was exclusively breastfeeding in the hospitals that had implemented the 10 steps in comparison to only 0.6 in the control group. So you can see there was a significant impact on exclusive 6 months breastfeeding, but you can see also that it's not enough to deliver in a baby-friendly hospital. The implications is that you need other interventions, other support to get mothers to continue to exclusively breastfeed till 6 months. So again, to summarize, my point of discussing the factors that increase the strength of a research study's finding, as well as a Probit study, was to give you some tools to assess the research out there, in particular when you're looking at the link between breastfeeding and the medical advantages to the infant and also to the mother. So having shared with you factors that increase the strength of a research study's findings, let's talk about some of the research findings that demonstrate what kind of impact breastfeeding has on infant and maternal health outcomes. The studies that I'm sharing with you and the specific health outcomes I'm choosing to mention are ones that have strong evidence linking the particular health outcome with breastfeeding. Breast milk has nutritive qualities and immunological factors that are lacking in artificial baby milk. And what we find is that human milk protects infants against a variety of infections outside the GI tract, including upper and lower respiratory infections, RSV, urinary tract infection. Breastfeeding also protects the infant against the risk of a variety of childhood cancers, including leukemia and lymphoma, Hodgkin's disease. We also know that human milk protects infants against a variety of chronic and autoimmune diseases, including allergies, asthma, celiac disease, inflammatory bowel disease such as Crohn's, and ulcerative colitis. Human milk also reduces the infant's risk of becoming overweight and obese, developing type 2 diabetes, being a victim of sudden infant death syndrome. It also is related to an increase in intelligence test scores. In addition to breastfeeding having a positive impact on infants' health outcomes, when mothers breastfeed, they also receive benefits, including a reduction in risk in breast cancer, ovarian cancer, a reduction in risk in cardiovascular disease and hyperlipidemia, hypertension, reduction in risk in obesity, type 2 diabetes, postpartum blood loss, and also postpartum depression. So you can see that there is a substantial number of medical advantages to the breastfed infant and the breastfeeding mother. What we also know about breastfeeding is that breast milk dose matters. And so what I mean by that is the quantity and duration of breastfeeding are positively associated with health benefits from the mother and infant. More specifically, it means that when an infant is exclusively breastfed and gets only breast milk from the time they're born, they're going to have many more health benefits that they receive from that breastfeeding than an infant that's partially breastfed. Partially breastfeeding means that they're getting some breast milk and some formula. Along the same lines, longer durations of breastfeeding are associated with more advantages. So if a mother is breastfeeding for 1 year versus 2 months, that breastfed infant that's receiving a whole year of breast milk is going to receive more of those health benefits than the infant that only received breast milk for 2 months. Same is the case in terms of maternal benefits. The longer the mom breastfeeds, the more health benefits to the mother. And the way that we look at duration of maternal breastfeeding is how long did the mother breastfeed each of her children. So for example, if a mother has 3 children and she breastfeeds each of those children for a year, that would be considered 3 years of breastfeeding. If the mother has a set of twins and then she has another set of twins and she breastfed those twins, set 1 and set 2, for a year, that would be considered 2 years of breastfeeding. There's no extra breastfeeding duration that's added on if you breastfeed 2 at one time. So we talked earlier about what the breastfeeding recommendations are. We mentioned that the gold standard optimal nutrition for that infant is 6 months exclusive breast milk, adding complementary foods at 6 months, and continuing to breastfeed for at least a year or longer. Given that that's the benchmark, what do you think are the rates of breastfeeding in the US? Is everyone breastfeeding till a year? How about 6 months exclusive breastfeeding? I want you to pause the video for a moment, jot down on a piece of paper what you guesstimate is our breastfeeding rates today. So how many women try breastfeeding? How many women initiate in a hospital? How many women make it to 6 months exclusive breastfeeding? And how many women keep breastfeeding for at least a year? Once you write down those numbers, I want you to turn on the video and see what our current rates are and compare it to your guess. So in the US, we have about 83% of women who are initiating breastfeeding. What this means is that in the hospital, when the baby is born, 83, that's the majority of women are trying it. Now, just so you know, for your own information, breastfeeding initiation rates mean that the mom tried it. It could be that she tried it for 2 seconds. It could be that she tried for an hour to breastfeed. It just means that she tried. She held the baby near the breast. Those rates in the US, initiation rates, are pretty high. But by the time we make it to 6 months exclusive, we have only 1/4 of the population that actually meet the optimal nutrition guidelines. And then when we talk about 1 year, we have about 1/3 of the population, 35.9%, that are still breastfeeding at 1 year. So taking those numbers in mind, do you think that the current breastfeeding rates are high or low? So it depends on what you compare it to. If you compare it to ancient times where pretty much the only thing infants were fed was breast milk, then these rates are extremely low. But if you compare it to the rates in the 70s, which at the time it's estimated that only 20% of women were even initiating breastfeeding, then our breastfeeding rates are quite high. And this actually is the end of this online session, and it's a great transition to our next 2 online sessions, which will focus on taking us through the history of breastfeeding, talking from caveman days, discussing factors that led to declines in breastfeeding, and then we'll talk about factors that led to a shift and a gradual increase in breastfeeding rates up until today where we are. And after we go through that historical context, then I'll start with sessions that focus specifically on providing you with the content knowledge you would need to educate women and their families in the community on how to breastfeed successfully.